Let me briefly tell you what we have done in the last 20 years practicing in the high desert in Victorville, Apple Valley area in Southern California. We have gained a lot of knowledge in taking care of very critically ill patients. And in the process, I've also developed certain skills. Skills in terms of doing very complex interventions in terms of coronary artery, peripheral arteries, as well as carotid arteries. So over the last 10 years or so, we have been involved in a lot of research, both in taking care of patients who are extremely sick patients like patients with end stage cardiomyopathy, that is, the heart is no longer functioning well, and how do we treat them? Short of transplanting the patient, that's the last option, but we have to treat them prior to them receiving heart transplant. So we have developed a very comprehensive congestive heart failure clinic. And a lot of physicians in this area, as well as throughout Southern California and nationally, have come to see our CHF clinic and to model it on how we have created our own congestive heart failure clinic. So a lot of physicians from outside the state, within the state, have come to model their practice on how to establish a congestive heart failure clinic. And that is just not because of me, because of the personnel that we have. We have tremendously dedicated ancillary services, nurses, and my right-hand person for that is Dan Austin, who is an RN, who is instrumental in essentially establishing and caring for this patient. We also do complex interventions, as I said. So over the last 10 years or so, we probably have trained over 200 cardiologists, vascular surgeons, radiologists in complex carotid interventions as well as peripheral interventions. We recently participated in the Heart Institute, especially with me being the primary investigator in 2 different studies. One involving placing very complex pacemakers or defibrillators to see how we can monitor the defibrillators to see whether before a patient has an episode of congestive heart failure, can we capture or can we monitor, can we determine or predetermine, in fact, that these patients are going to decompensate and can intervene. That's one of those studies we just did. A second study we did was essentially looking at octogenarians, that is, patients who are over the age of 80, who have carotid artery disease, who have had strokes, to see whether they are candidates for undergoing angioplasty. The current recommendation is patients who are older than 80, to undergo stenting carries a very high risk for complication. But we have shown in our study that it's doable, it is safe if the right precautions are taken. So those kind of studies are ongoing. We have trained over 200 patients in peripheral and carotid angioplasties, and we have participated in national studies that involve implantation of AICDs. We have also participated in national studies in terms of stenting for carotids. So we are a very aggressive, at the same time, we keep up to date in both in cardiology and cardiovascular disease.